Hi, my name is Ajit, and I'm very happy and excited to share findings of my research among South Asian communities in British Columbia. And I have a short PowerPoint presentation to share the findings of my research. So in the previous three videos, actually, I introduced this overall research design and showed the findings of my quantitative component, qualitative component, and how we use these findings to develop the educational materials. But we also wanted to actually bring on the latest technology, which is being developed by the BC Oral Cancer Prevention Program to this high risk individuals to achieve our overall goal of reducing the incidence and mortality among the South Asians. We collected the data from an ongoing longitudinal study in British Columbia from 1999 to 2008. There were 296 patients, and we had information on all the demographic, clinical, and pathological features of these patients. 22 of these patients were South Asians, and predominantly they were men who were non-smoker, and only one-third of them actually consumed alcohol. Brittle quid and smokeless tobacco history was not taken among these patients, but we knew from the subsite analysis that majority of these cancers actually occurred at cheek and gums. So these findings were consistent of what we actually found in our epidemiological study, that South Asians had higher rates of cancers at gums and cheeks, and also to our qualitative study that actually showed that they are actually keeping the quid between the gums and cheek. The lesions which are caused by chewing habits are different than from smoking, because there's a lot of burning sensation and fibrosis that are the presenting features among South Asians. So when we use the fluorescent visualization technique, we found that the pattern of fluorescent loss was different. That showed that the lesions are different because the biology is different. And hence, we cannot just use the technology which has been developed predominantly on Caucasians in British Columbia to South Asians, because their habits are different, the tissue is different, and the biology and the natural history of the disease is quite different. So we conclude that oral cancer among South Asian is an emerging problem in British Columbia that warrants action. And globally, about 40% of cases are actually seen in India. Chewing tobacco and brittle quid leads to different lesions, and we need to actually validate the new technology to these new high-risk populations for a better and effective oral cancer control. Thank you very much.